Okay, so I will tell you what I do with my patients. If someone has failed multiple trials of antidepressants, I first make sure that they've had a really good trial of an antidepressant. And by that, I mean max dose. Sometimes we go above in the right circumstance for at least 4 to 6 weeks. And people oftentimes will think that they have failed antidepressant trials when they really haven't gotten to a high enough dose. Once we've established that somebody has been on a decent dose of an antidepressant for long enough, then we start talking about augmentation strategies. So augmentation strategies that I typically use are things like adding a mood stabilizer, lithium, Depakote, lamotrigine. We talk about adding an antipsychotic, things like Abilify or aripiprazole, risperidone, can even do Haldol, ziprasidone, Seroquel. Anyways, so we talk about doing one of those things for augmentation. Sometimes in the right person, we'll also talk about adding a stimulant medication. So things that you would traditionally use for ADHD. And throughout this whole process, we're also making sure that you are getting good quality therapy. And we're also making sure that your diagnosis is correct. Because sometimes if people aren't responding to antidepressant therapy, it's because they don't just have depression. They have something else as well. Also, if you haven't already, we are making sure that you've gotten a good physical exam and some lab work to check for any physical issues that could potentially be causing depression. You'd be surprised at how bad depression can be with things like anemia or thyroid problems, so it's always worth checking. Okay, so say the medications don't work or they're not an option, or we just want to move forward with something else quickly. Then we start talking about procedural treatments. So the first one that I tend to think about in the right person is TMS, transcranial magnetic stimulation. And the reason I think about that before other options is because it is not invasive. It requires quite a time commitment. So you have to go like 5 days out of a week for an extended period of time. But it does work pretty well in some people. You also don't necessarily have to have tried a bajillion med trials to qualify for it, and most insurance companies will cover it. If all of that doesn't work, we talk about ECT. ECT is by far the most effective treatment that we have for depression, and the reason that we don't do it sooner is because it requires going under general anesthesia, and there are also potential side effects. Things like memory problems are the most significant, but it is extremely effective. And the other thing that we consider if antidepressants aren't working is potentially hospitalizing someone to try and see if we can make changes faster.